It's been said that the eyes are the key to the soul. So let's find out today in this episode of Rohrich and Dr. podcast from a world expert on oculoplastic surgery, Dr. Steve Fagien. Steve, welcome. How are you doing?
Doing great, Rod. Thanks for having me back.
It's great. So, you're a world expert in so many things, but especially in oculoplastic surgery and in blepharoplasties, because you really helped plastic surgery pioneer the fact that we don't have to take fat out of the eyes. And I remember people were so critical of that. And yet we in plastic surgery finally learned a lesson that taking fat out really made people look older. So let's fast forward to today where we've kind of got more common sense on, so what makes a great eye look good at 20, 30, and 40? And just break that down so we can, we don't always need surgery. So let's look at a 20 and a 30 and a 40-year-old eye and just tell me what you think and what you tell your patients.
Well, as you've experienced, I'm sure in your practice, they're coming in younger. They're coming in their 20s. And a lot of them, because of social media, Instagram, and so forth, they're asking to have eyelid surgery. And some of it, frankly, at their age is not appropriate.
Right.
And sometimes it is. But there are some non-surgical things, like somebody who has a little bit of a drop brow that it's obviously not age-related in their 20s, and it's familial. You can raise brows with Botox or neuromodulators. Sometimes you can do fillers, even though that's, and not necessarily in the lower lid tear trough, but in areas of the brow for reflation in the temples, and that can look good and make the eyes look better. But generally speaking, I stay away from fillers in the lower eyelid. But at times, patients, for instance, someone with a familial trait of just in their teens, they basically had bags in their lower eyelids.
Right.
Frankly, it requires surgery, but conservative surgery, because obviously young patients don't need much. And I will talk a lot of these younger patients out of surgery and have them wait a while, because the problem with being very conservative is it typically doesn't last as long. Right. So I tell them, why don't you wait until it bothers you enough to embark on surgery? Now, my most common age, my average age patient in my practice is 40, which is much different than 20 years ago.
Right.
But the 20-year-olds try to either suggest that they're not quite ready for surgery unless it's only a surgical problem and it really bothers them, and then being fairly conservative when that is appropriate.
Yep. No, I agree. And we've talked in a previous podcast about how, use of fillers in the lower eyelid probably should be done with great caution today. But what about the natural stimulators, the matrix ones like PRF, platelet-rich plasma, PRP, and things like that, and the new one that actually is platelet-derived growth factor, Ariescence. I mean, what has been your experience with that? And I'll share with you my experience.
I don't have a lot of experience, but I've seen nice results.
Yep.
And you can see nice results early on with a lot of things.
Yep.
What I'm more interested in is how sustainable those results are. So a lot of these processes look fairly well early on.
Right.
And if somebody's looking for not a long-standing, long-lasting result, but wants improvement and is not willing to go through surgery, I think those are very viable options. But if they want something that's going to last for years, that may not be the way to go. So I think there's a place for that in the appropriately selected patient.
Yep, no, I agree. And also if they have some slight hyperpigmentation, there's no treatment for dark circles, but PRF and platelet-rich plasma and platelet-rich fibrin does help, and also bioengineered PDGF, which is really new on the market, works well for that because you don't have to take any blood. You can just blend it into the eyelid, and actually I've seen some good results in my patients in the last 6 months in doing that. It's not a filler, but it just helps to energize, the matrix so that actually it helps to blend the pigment a little better, and it helps also with the tear trough. But it's not a long-term result, but it gives them a smooth result short-term. But you're right, surgery is the best.
And a lot of patients are okay with something that'll last several months. I mean, they do injectables, which last several months in most patients, at least the aesthetic effects. So there's nothing wrong with that. And I think we're in the infancy of learning a lot about these stimulators.
100%.
So I think it's an exciting time, certainly with exosomes and all these other things that we know are important, growth factor, as you mentioned. And we'll learn a lot more with more experience and who is the appropriate patient. And I agree with pigmentation, nothing has worked well. And if that works for hyperpigmentation, that's a winner.
Yep. Yeah, I mean, it's an adjunct. There's no cure, as you know, for any of those things. But so, okay, you mentioned the 40-year-old. So in the 40-year-old, obviously, these are good candidates for eyelid surgery, right? It's one of the first things that you see for aging. So
Yeah.
tell us about that. I mean, upper and lower eyelid surgery.
Yeah, so not everybody needs everything. And I have patients that come in for just for uppers. And sometimes, interestingly, their lowers in my
Right.
assessment are worse, but they only see their uppers. So I've learned over the years, you address what the patient's concerns are, not what your concerns are. And then you can give them good advice, and then you still go with what bothers them the most. Because I found if they don't see the problem, they also don't see the result. So
That's so true.
most patients who come to me have uppers and lowers done at the same time because they're aging, and that's age related. Not that 40 is old, 40 is young, but they want to look 30.
Yep.
And they don't want to, as they're starting to change hormonally, especially women, especially women who have always gotten looks, and eyes have been their best feature. And when they're not getting the looks that they used to have, they look at themselves in the mirror and go, I'm just not looking like I used to. I don't want to look different. I just want you to put me back to the way I was 10 years ago.
Right.
And I think good surgery, like anything else, you look like nothing ever happened.
Right.
And that is not easy to do. So I think you need to not only be selection your patients appropriately, but pick the procedures, which in my practice are not all that different in everybody, but there are nuances that one patient may need more of this than that. And that is the art of experience. There are so many good surgeons out there, but experience always trumps everything. When you know what this patient needs versus this patient to get that best natural result.
Right. And I think those are such wise words because you have to listen to the patient's concerns. It's just like rhinoplasty. That's why I was asking their top 3 concerns. And fix that primarily because then you're going to have a happy patient. And that requires experience and expertise and the ability to do, exceptional things, the three E's and also the eyelid surgery is very, very unforgiving, as you and I have seen. And I've sent you some incredibly challenging patients that have had some incredibly not so good eyelid surgery done elsewhere. And they're challenging.
They are, and
they're hurt.
It's distressing to the patients because, it seems obvious, but you make eye contact with people. They don't necessarily look at someone's ear, but they're looking right at your eyes or your nose, center part of the face.
Right.
They see that. And when you look in the mirror, patients are looking at their eyes typically.
Right.
And when they see things that are distorted, it's bothersome to them, and they believe, which sometimes is true, that everybody else sees it as well. So cosmetic eyelid surgery is in many ways unforgiving.
100%.
And you need to, I have patients come in and said, well, I saw somebody and they said they can make me look better. Well, better is good, obviously, but what patients want to look, they want to look great. They don't want to look a little better. They want to look like nothing happened. Right. And people go, oh my gosh, you look amazing. And they don't know they had their eyes done or their nose done when you do it.
Right. That's exactly right. So what are some take-home points, 3 take-home points for the viewer when they're considering doing their eyes, if, when, where, and who? Experience
is everything, as you and I have learned. I think you should ask your surgeon, is this something you do primarily? Right. Frankly, how many do you do a week or a month? Right. If they tell you, well, they do one every couple of months, that doesn't mean they're bad surgeons. It just means they don't have the experience. Right. And experience will, again, tell you what you need versus your neighbor who may have had eyelid surgery, but completely different. You hear this all the time. My friend had her surgery done and it was a terrible result. Or my friend had a result and in 3 days she looked great, but in 6 months it looked like she needed her eyes done again. So there's such an art to everything that we do, and it's all in the detail. It's addressing every detail, and as you so appropriately put it, fix their primary concern first and foremost.
Yep.
That needs to be fixed. Everything else, great. It should be great. But if you don't correct the problem they came in with, they're not happy, and they shouldn't be.
That's exactly right. Wise words from a wise surgeon. You know, it's all about nuances, the patient's concerned, and it all hovers around an experienced and honest and ethical plastic surgeon that understands the aging process of the eyes. So Steve, thank you again so much for all you do and all you've taught all of us in plastic surgery. So thanks again, and until next time, stay wise, and remember, the eyes are the heart of the soul. Okay.